talk about shoulder bursitis today. Okay, so shoulder bursitis. Oops. Okay, sorry. So I'm back on. So before we get into shoulder bursitis, for those of you who don't know me, let me introduce myself. My name is Swati. I'm a physical therapist, and I do these videos to bring about patient awareness and to let you know the relation between your diagnosis, your symptoms, and just to clarify. If say you're suffering from shoulder bursitis, why do you have it, what actually is happening in your shoulder, so just taking the mystery out of the diagnosis, really. So if you're watching me on the live, please comment. You can just comment hi, hello, anything really. Shoulder, hi, whatever you want to, just so I know you're here. And if you're watching me on the replay, please comment hashtag replay so I know you've been here. Okay, so if you like what I'm talking about at the end of the video, please go over to my YouTube, and I would appreciate if you would subscribe. If you would like to be notified about my other live videos, please press the bell icon so YouTube will let you know when I'm live the next time. Alrighty, so going back to our topic, shoulder bursitis. Okay, so oh yeah, for those who are watching me on IG, my YouTube link is in the bio, so you can just take it on from there. And those of you watching me on Facebook, I'll leave the link in the description below. Okay, so shoulder bursitis. What is a bursitis? So to understand what is bursitis, let's look at what is a bursa. So basically, a bursa is a fluid-filled sac, or like a cushion, or like if you fill up a balloon with a fluid. Really, it's just that, right? So, where is a bursa found? In between any two interfaces in the body, usually between a tendon and a bone. So, for example, if I have say this is my bone and there is a tendon that's coming to get attached onto this bone, we don't want any rubbing in between that tendon and the bone, so there's a bursa present there. So just to go back to basics, what is a tendon? If your muscle, this is say your bulk of the muscle. So if you look at these are your tendons. So where the muscle is tapering off to attach onto a bone, it will usually go into these ropey, stringy structures, which are a part of the muscle, but the end part of the muscle they call the tendon, especially where they're attaching to a bone. So suppose my muscle is coming and attaching onto, for example, this bone here. So I don't want that the tendon keeps rubbing on the bone every time. So there is a bursa present there. So it's like having, this is my bone, this is the tendon. So there's a cushion in here. So the rest of the tendon, which is not attached to the bone, but just sitting in close proximity to the bone, it doesn't get rubbed onto the underlying bone, right? Now, what happens in bursitis? There is an irritation of the bursa. So for some reason, the bursa is getting irritated and it gets inflamed. Now, sorry, I'll be referring to my notes, so I go in the sequence that I want to, so do not mind me looking away. So yeah, so this swelling is known as a bursitis. Now, what is anything that says itis, so itis at the end, like a tendinitis, basically that means an inflammation, right? So tendinitis is inflammation of the tendon, bursitis is inflammation of the bursa. Okay, so what happens is your bursas are usually very thin like a paper, but when there is bursitis happening, you will this paper like outline of the bursa or the lining of the bursa becomes thick like a cardboard, right? And so imagine there is a very narrow space, there is a bone, so there's a tendon over here, there's a bone over here, and there's a bursa sitting in between these two structures protecting that tendon, right? Now, when this little space, there's a swelling and the bursa all swells up, there's inflammation, obviously there'll be more rubbing on the tendon. So it's doing exactly the opposite of what its function is. So the bursa will actually create more pain and inflammation in that area. You might even get tendinitis because of that underlying bursa being inflamed, right? So, this is basically what happens in a bursitis, right? Simple enough. But then we are talking about shoulder bursitis. Now, there are about 6 bursas sitting in and around the shoulder complex. When I say shoulder complex, it is not just this particular joint where your long bone comes and attaches into your body, right? So this long arm bone attaching onto the body. Apart from that, there's also a acromioclavicular joint, which is also known as the AC joint, which we spoke about in the video where I talk about the pain on the point of the shoulder. You can go back to my YouTube to watch that if you want. So there is a AC joint there. Then you have the shoulder blade back here, right? So those there's a lot of structures involved in the shoulder complex. So there are about 6 bursa protecting the area around the shoulder complex. For example, there's, if you look at your deltoid muscle here, there is a bursa sitting between your this shoulder joint here, the glenohumeral joint as we scientifically call it, and the deltoid there. So that is called a subdeltoid, like under the deltoid bursa, right? Sub is under. So we also have a subacromial bursa. So now these are, this is commonly affected, this subacromial bursa. So that's why I'm just referring to this. Not necessarily that you will only have subacromial bursitis, but then you can have other type of bursitis. It's just the common one. So if you, okay, let's go the simpler way. If you trace your collarbone right to this end here, and where it meets this corner of the, like this edge, sorry, of the shoulder blade, this is your AC joint, right? So this back part of the collarbone, the front part of the collarbone meeting the back part of that shoulder blade, the tip of that shoulder blade is the acromion. So right under that there is a bursa, and it tends to get inflamed in shoulder problems. So we look at your symptoms later on. But the bursitis can happen there. Now, what are the types of bursitis? Like that can be anywhere in the body, but what are the types of bursitis? One of the rare ones, let's get that out of the way, then we talk about the common ones. One of the rare ones is where you get a bacterial infection. Remember, it is a fluid-filled cavity. So, and it's a good medium for your bacteria to grow, right? So that is called infected bursitis. So basically there's a bacteria growing inside that gives you the inflammation and then leads to bursitis, right? So the other one is called a traumatic bursitis, where say I have a sports injury, like contact sports, where somebody comes and hits me on my shoulder, right? So I can have that. Or if say you are a musician, say you play the violin, so you know how violin when you're playing the violin, you will hold it on your shoulder. So you're putting it onto your shoulder, and there's a lot of repetitive rubbing onto this area. So that will lead to something called an overload or chronic bursitis, right? So that sports injury or fall on your shoulder where you have a trauma or an accident, that is traumatic bursitis. And an overload or chronic bursitis is, say, somebody who's a musician. So there's a repetitive injury, so repetitive stress on the shoulder. Or if you're a carpenter and you do a sawing action, right, where you're using a saw. So I know everything's mechanical now. So if you're one of those who are still using the handheld ones, you can get repetitive stress injuries. You can get a tennis elbow. You can get a bursitis in the shoulder. So there's a lot of damage that can happen, right? So that is your overload or chronic bursitis. Okay. So there also are some predisposing factors. Say if you have a gout, or you have diabetes, or you have rheumatoid arthritis, that'll make you more prone to getting bursitis. Okay. So what happens when you have bursitis? How would you know? You obviously have pain. So we're looking at the symptoms now. So we have pain in the shoulder. You would have if you lie down on the affected side, obviously there's a lot of discomfort. So a little bit more than the other shoulder conditions that we've spoken about. So now we're doing a series of shoulder conditions. If you go back to my YouTube or my videos, you will see we're doing a series. We've covered frozen shoulder, AC joint injuries, impingement of the shoulder, instability. So we've covered quite a few conditions. So if you look at all of them, they'll have this pain when you're lying on the shoulder. The reason being there's inflammation, right? There's active inflammation in this area. And on top of that, when you put your whole body weight onto that side, obviously you're putting pressure on an inflamed area. Imagine if you have a wound and you're putting pressure on that, obviously it's going to hurt, right? So yeah, so it does happen in every shoulder condition, but in bursitis it is markedly more, right? So you will feel it more if you have a bursitis and you're lying on that side. Obviously, you feel the pressure within the shoulder even when you are sitting there not doing anything if you have an acute bursitis, right? And then comes your other symptoms. I mean, uh, like overhead activities will be painful, etc., etc. Now, how does this bursitis get diagnosed? Obviously, your doctor or your physiotherapist will look at your symptoms. On top of that, if you look at the diagnostic imaging, MRI will show it definitely. If you also have calcification, that is deposits of calcium within the bursa, if you've had the bursa for a long time, so if you have chronic bursitis, it can show up on x-ray, but that's not like a sure definitive diagnostic finding. So usually your doctor will send you for an MRI if they want to find out more, but usually I mean, they'd be able to diagnose it without that as well. Now, if you have infected bursitis, obviously a doctor will give you antibiotics, right? Because it's bacteria, so antibiotics work on bacteria. So the doctor will give you antibiotics. If the antibiotics don't work, then they will go in and pull out the fluid in the bursa. They will test it, what is the bacteria, and then give you a specific antibiotic for those bacteria, right? And if it is, say, a chronic bursitis and it doesn't go away with the usual anti-inflammatory drugs that a doctor will give you, then they will go in and give you an injection of corticosteroids. Usually, for any joint, the standard rule is that the doctor will not give you more than 2 or 3 steroid injections in the ear, because the area gets weakened and you are more prone to tendon rupture. Okay, so also, if the steroid injection also doesn't work, then the doctor will do a surgery, but it's not like an open surgery where they'll cut open the shoulder. It's arthroscopic. So basically, they go in through these tiny holes and they go in. They will drain the fluid from the bursa. And if the situation is really bad, they will have to remove the bursa. And in either cases, they will put in some medication within the area of the bursa. Both the situations, whether you have an injection, well, whether you're on medication, whether you have injections, or whether you have a surgery, you will have to do physiotherapy after that. So, well, that's where I come in. Okay, so in physiotherapy, we look at really gentle exercises, plus depending on which bursa is affected, what are your symptoms, there are specific protocols that we follow for bursitis patients, right? So obviously getting you back to your daily activities, which will be affected because of the pain, and gradually training you, if you are an athlete, then gradually training you to get back to your sports. All that will be covered by your physiotherapist. Now, this video is mainly to help you understand why you get the bursitis and what are the symptoms and what is all the medical jargon. When somebody says you have an infected bursitis, what is it? How is it different from, say, a chronic bursitis or a repetitive strain bursitis, right? So, if you want to know more about this condition and you want to know more about the solutions to this condition, feel free to pop into my free Facebook group. I'll leave a link in the description. And for those of you who are watching me on Instagram, the link is to the link is in my bio. It says my community, and that's my free Facebook group. So we look at the solutions there. Feel free to join the group, and we also discuss many other similar topics in there. Sometimes the solutions are really simple, right? It's just that you need to be directed towards them. So do not fret if you have this condition. Feel free to contact me if you have any questions about this, and I would love to answer your questions. Alrighty, I will call it a day, and I will see you guys the next time. Nice talking to you. Bye.